All the way forward.
HIPAA matters because it protects the residents' privacy, whether it's their medical record or their financials. And that's what, I mean, we have to keep everything private. We can't send out information to somebody if it's not theirs. Somebody got sent a bill that wasn't for them, and they kind of panicked. So we even have to make sure that even from the billing office, that that was a real big HIPAA violation right there. Who's responsible? Everybody that works here is responsible. Who does HIPAA not apply to? Life insurance carriers, workman's comp, many state agencies, especially like if they're investigating child services, or abuse. Who doesn't need a required PHI, which is authorization for treatment, to obtain payment, and investigation of crimes. They don't need consult or authorization to come in and look at that kind of stuff. I'm going to give you a couple, some scenarios. You have to excuse me, I've never done an in-service like this before, so I'm kind of not a good speaker. While a neighborhood cookout, a receptionist at a healthcare practice mentions to a friend that she saw a mutual friend at the office last week. Is this a violation of HIPAA? Yes.
She mentioned what? Where was she? If a patient went to a doctor's office. Oh.
And the receptionist was outside of work. Is that, yes, it is. Yes. Healthcare providers must avoid accidental disclosure through routine conversation. A hospital sends out a mailing to former patients informing them about a cardiac facility that can provide a baseline EKG for $39. When the communication is not for the purpose of providing treatment advice, is this a violation? Yes, because it's a marketing tool. You can't use it for marketing. An employer noticed from a healthcare insurance records that an employee's wife just gave birth to a healthy baby boy. The employer congratulates the employee when he sees him having lunch in the cafeteria with coworkers. Is this a violation? Yes. Even if we work here, that's still under HIPAA. Even from the HR perspective, that's still covered under HIPAA. A patient learns that her medical practice has forwarded her medical information to a collection agency. Is this a HIPAA violation? No, because it's to recover payment. An oncology practice requires all patients to sign in when they arrive at the office. Is this a violation? Yes, because they're all cancer patients, so they don't. Oncologists, they do not have sign-ins, just like psychiatrists. There's no sign-in. An elderly patient is always accompanied by her daughter to her doctor's appointment. After the mother is prescribed a new medication, she develops a rash, which the daughter believes may be related to the new prescription. The daughter calls the office to discuss with the staff. Is this a HIPAA violation? No, because her daughter is her POA and she goes to all her appointments with her. The best thing around here is you guys just got to be really careful what you say. Even in the gym, when you're just, talking about a patient, try not to discuss his diagnosis while you're in here, Because there's a lot of family members that come in here and sit, and a lot of patients, and everybody can hear, you know. Same with on the floor, you know, so we gotta be really, really careful what we say, you know. Some people it's okay with, some people get very offended, and, you know, so we gotta be really careful. I have this little testing, so we'll just go over that real quick. The use of protection, the use of PHI without a client's written authorization allowed for all the following reasons except for which one? D.
Will that B or D?
D. Health insurance. Number 2, a health insurers and health providers who are covered entities must comply with your rights to D, which is all above. Number 3, that these are reasonable precautions that should be taken to ensure information privacy and security, plus make your patient feel more comfortable about their privacy. Which statement is false? D. Who is not required to follow privacy and security rules? That would be D, Child Protective Services. We call the individuals and groups that must follow the HIPAA regulations, they're called entities, covered entities. The security rule specifies a series of administrative, physical, and technical safeguards for covered entities to use to assure the confidential integrity and availability, and that's electronic PHI. The privacy rule, a federal law, gives you rights concerning your health information and set rules and limits, and who can look at and receive your health information. The privacy rule applies to all forms of individuals' protected health information, whether electronic, written, or oral, and that is true. Number 8, these items, telephone numbers, electronic emails, dates, medical record numbers, help to recognize who a person is. What are these items called? Number A, identifiers. The privacy rules calls individual identifiable health information, PHI. Number 10, if you believe your rights are being denied or your health isn't being protected, you can file a complaint with your providers, file a complaint with your health insurer, file a complaint with the U.S. government. All of the above.